Welcome to our video about ringworm. What is ringworm? And how does it spread? If you're suffering from ringworm, you've probably already seen the characteristic red, scaly rash. But what is ringworm? And how does it spread? Read on to discover what you should do to get rid of this nasty infection. This disease is caused by different kinds of fungi that live on our skin for indefinite periods of time. And while it primarily affects males, it can affect both sexes and children before puberty. What is ringworm? Is a fungal infection that is spread through direct contact or objects that are infected. Most often, it is contracted through contact with infected soil or objects. It can also be transmitted to humans through touching infected objects, animals, or people. Fungal infections are relatively rare, but they can be difficult to treat if the immune system is weak. Listed below are the symptoms and treatment options for ringworm. A topical corticosteroid cream, lotion, or loofah may relieve itching caused by ringworm. However, if you use steroids alone, they will only make the fungus spread and worsen the condition. You can also purchase a combination product that contains both a steroid and an antifungal agent. These products usually cost more. However, they will help alleviate itching and the associated skin rash. To avoid contracting ringworm, avoid sharing personal items, clothes, and towels with others. Wear waterproof shoes and shower after contact sports. Make sure to keep uniforms and gear clean. Make sure to wash all personal items and bedding with hot soapy water. If you are unsure of whether or not someone is infected, visit a doctor or a veterinary clinic to get a full diagnosis. You may also try avoiding touching infected animals or other people with ringworm. Ringworm symptoms. Treatment for ringworm infection can vary widely. In some cases, topical antifungal creams will be effective for treating infected skin. These creams can be purchased over the counter or online. More severe cases may require oral antifungal medications. Proper antifungal treatment is crucial in ringworm case management. Ringworm can be transmitted from an infected person, animal, contaminated soil, or object. The infection can be transferred from one part of the body to another through broken skin. This fungus is more likely to spread among weakened individuals. Ringworm is a fungal infection caused by a fungus that feeds on keratin. People with compromised immune systems are more likely to develop ringworm. There is no known cure for ringworm, but proper prevention will ensure that you stay healthy and free from infections. If you suspect your dog has ringworm, check for signs of the infection. Dogs with the condition will lose fur in circular patterns. If you notice your dog losing fur, contact your veterinarian for a thorough examination. A veterinarian will recommend an appropriate treatment. You can also consider trimming back the fur or undergoing an antifungal medication. The lesions should clear up in about 1 to 3 weeks. Cats are also susceptible to ringworm and can transmit the disease to humans. About ringworm. When it comes to learning about ringworm, there are a few things that you should know. It starts as a small pimple and grows to be a patchy, bald condition. Untreated ringworm can also make your hair brittle and discolored. It can even spread to the nails, making them thick and chalky. On the body, ringworm can appear as ring-shaped areas of reddish skin and crust. It can also appear as discolored, scaling, or cracked skin on the feet. It can be spread to other people and pets through close contact with the rash. The infection is most commonly spread in children and can be transferred to pets and clothing by contact with infected individuals. A child can also contract ringworm by touching an infected animal, contaminated floor or furniture, or playing in dirty water or with wet equipment. This condition is highly contagious, so preventing transmission is essential. However, it's possible to protect yourself against ringworm with the right education and preventive measures. In order to avoid spreading ringworm, make sure that you wash your hands regularly. Keep in mind that the infection can be spread through clothing, shoes, and personal items. If you are not careful, you may contract dermatophytosis. If you have been exposed to an infected animal, be sure to wash your hands immediately to avoid spreading the disease. Remember, fungi love warm, moist places. So, keep these factors in mind when cleaning your house. How ringworm spread. It can be difficult to diagnose ringworm by yourself, but a doctor can give you the best diagnosis possible based on your symptoms, history, and other factors. They may even perform a skin scraping and test a sample of infected skin in the laboratory or under a microscope. Mild cases of ringworm can usually be treated with over-the-counter antifungal products, but more serious infections may require prescription medications. The prescription medicines may come in a pill/syrup form. You can also apply antifungal shampoo to the infected area to prevent its spread to others. The infection is contagious until the spores are killed off, and doctors don't know when the fungus is completely eliminated. The fungus spores can live for up to 12 to 20 months if they're in a good environment, so treating the ringworm as soon as you spot it is important. Once treatment has begun, ringworm will stop being contagious and you can begin to live a normal life. The fungus that causes ringworm spreads through contact with objects, surfaces, or soil. It is most likely to spread when a person is in contact with highly infected soil or objects. Exposure to warm, moist areas puts people at a higher risk of contracting ringworm. People in warm climates are also susceptible to it, as well as people who frequent locker rooms and swimming pools. Young children who are not yet puberty are also at risk. People who wear tight clothing or play contact sports are also at greater risk of contracting ringworm. Ringworm diagnosis. Before a fungus infection can cause a rash, you should be diagnosed first. If the rash is very persistent, it may mean you have ringworm. In addition to the rash, there are also other signs of ringworm. Some people experience jock itch, which is a type of ringworm. Affected feet will appear scaly and red and may be painful. A dermatologist can diagnose the condition and prescribe stronger medication. The gold standard for ringworm diagnosis is a positive fungal culture. A Wood's lamp examination, which uses ultraviolet light to determine if hairs have ringworm fungus on them, can also confirm ringworm. Hairs from the infected area are inoculated onto special fungal culture material. While this is the most reliable test for diagnosing ringworm, it may take up to 3 weeks before a positive result is obtained. A more rapid test, the polymerase chain reaction, checks for fungal DNA and can provide results in as little as 5 days. The main limitation of this test is the potential for false positives. For a more accurate diagnosis, a healthcare provider will take a sample of skin from the infected area and examine it under a microscope. The doctor may also do a co-exam, which involves scraping a small area of skin and examining it under a microscope. The co-test can also be used to identify ringworm, though it's more accurate to have it performed by a medical professional. If you think you may have ringworm, your healthcare provider will prescribe an antifungal medication and discuss other ways to treat the infection. Ringworm treatments. There are a number of home remedies for ringworm. The lavender essential oil has antifungal and antibacterial properties that can be applied to the affected area. Applying lemongrass oil to the affected area is also effective, though it must be diluted in a carrier oil. Another natural remedy is neem oil, which comes from the neem tree in India. Neem oil has antifungal and antibacterial properties and can be applied to the affected area as a topical cream. While ringworm treatments for ringworm are effective in curing the infection, you should visit your doctor if it has not improved within 2 weeks. The doctor can prescribe stronger antifungal medications to treat the infection. A physician should be consulted if the symptoms are severe, and it's best to avoid pets and other people with weakened immune systems. However, ringworm can affect anyone, including infants and children. As with any medical condition, you should always wash your hands thoroughly after touching an animal. As with humans, pets and other sources of the disease are potential carriers of the infection. If you're infected with ringworm, it's important to wash your hands immediately after touching any affected area. If you've touched the rash, it's best to take a shower as soon as possible. If you're playing sports with your children, make sure to keep your hands clean. Make sure to use dry towels and shoes. If you're in contact with a dog or cat, take your pet to a veterinarian to get a ringworm treatment. Risk and prevention for ringworm. What are the causes of ringworm? Ringworm is a fungal infection that can infect both humans and animals. It is commonly spread through contact with infected soil, especially in communal showers. Certain factors also place people at risk for developing ringworm. People living in warm climates are at a higher risk, as are people who live in close proximity to animals. Also, contact with contaminated surfaces is another source of infection. To avoid contracting ringworm, wash your hands frequently. Avoid touching ringworm-infected animals, such as cats, dogs, and goats. If possible, wash your hands thoroughly after touching a pet. When possible, take showers. After playing sports, take a shower and change your clothing. If possible, check your pets for ringworm before allowing them to enter your home. Once the symptoms subside, you can return to school or daycare. If you have ringworm on your scalp, you should follow the directions on the prescription medicine label. Your doctor may prescribe an oral antifungal medication. Topical antifungal shampoo can also help prevent ringworm on the scalp. The antifungal shampoo will also prevent ringworm on the scalp. Taking medicine every 2 to 4 weeks can cure ringworm on the scalp. If you still have symptoms, see a doctor for prescription medication. Prevention is key, but the best way to protect yourself is to follow the instructions on the label. Thank you for watching. Please like, comment, and subscribe if this was helpful.